My name is Stephen Broderick. I'm a thoracic surgeon and an assistant professor of surgery in the Department of Surgery at Johns Hopkins. My role at Hopkins is to treat patients with both benign and malignant diseases of the lungs, esophagus, and chest cavity, with a special interest in lung and esophageal cancer. One of the great things about my role is that I represent our division outside of Baltimore and outside of the main Hopkins campus. That gives me the outstanding opportunity to bring Hopkins state-of-the-art care and resources to patients further out in the state of Maryland. It's a great time to be a thoracic surgeon. There are a number of fascinating things happening. Most in particular, we're performing our operations in more and more minimally invasive ways. That results in shorter hospital stays, less pain, and faster recovery for patients, which is important, not only because it returns patients back to their normal lives and function faster, but for patients who do need to go on to additional cancer therapies, be it radiation or chemotherapy, they recover faster and are able to move on to additional therapies sooner. I became interested in thoracic surgery early on in my surgical training. I had outstanding mentors at Memorial Sloan Kettering and New York Presbyterian. In addition, I was inspired by the patients that I met on the thoracic surgical service. These were patients who predominantly had lung cancer or esophageal cancer, were going through a very difficult period in their lives, but they were incredibly brave, and they underwent operations and recovered well, and it was really a privilege to participate in their care. From a research standpoint, I'm interested in improving outcomes in thoracic surgical patients, particularly those with early stage lung cancer. My focus is on patients' quality of life and looking at how the different treatments that we offer patients, whether they're surgical, medical, or using radiation, impact patients' quality of life over the long term. And deciding how we can predict how those treatments will affect people and how we can improve quality of life, particularly after surgery. In terms of a patient care philosophy, I believe in a process of shared decision-making between physicians and patients. That is, it's my role to provide patients with information and advice and help them make informed decisions about their health care. That's what's really great about my position at Johns Hopkins, is that I have all of the resources of the university, the department, and the School of Medicine, but I also have the flexibility and time to meet with patients and their families and get to know them, help them determine what's important for them, and come up with a treatment plan that will best suit their personal interests. I get to do that as part of a multidisciplinary team at Hopkins in combination with our radiation oncologists and medical oncologists to come up with a personalized plan to best treat patients and maintain their quality of life.